Good evening, Professor. This is Daniel Chancellor, Ineo, MSN 572 Advanced Physical Assessment, and I am doing a integrity check for my abdominal video. And my patient there. And we're gonna dive right into the exam. Before we get started, I have to record this for my professor to assess my learning skills and put it on YouTube as Unlisted. Do I get a consent from you to record and post on YouTube?
Sure,
Did you get a chance to empty your bladder?
I did.
All right, so I would ask my patient to go ahead and lay down supine. And then I'm gonna put a pillow under her knees to relax abdominal muscles for during the exam. And that's my ruler and marker for measuring the liver. And I'm going to provide privacy by covering with a drape from the lower part of her body. And I'm going to ask patient to lift her shirt to the mid clavicle area and expose the symphysis pubis area for the abdominal exam. First line of the exam is inspection, so I'm going to inspect the contour of the abdomen by just looking at its symmetry, looking at the shape, looking to see if there's any scars, any lesions, scars, any stria or stretch marks, looking to see if there is any distended veins or any pulsations by the aorta, looking at the umbilical cord if there's any hernia relation, and no abnormal findings. Next step in our exam is going to be auscultation, and I'm going to listen in all four quadrants, which are broken up in right upper quadrant, left upper quadrant, left lower quadrant, right lower quadrant. But I'll start auscultating in right lower quadrant, and I'm listening for vowel sounds and listening for quality, pitch, gurgling, tinkering, pinkering of the vowel sounds. And I should have about 5 to 32, which is normal finding. And also I'm going to listen for 1 minute or 5 minutes in each quadrant. Moving up to the right upper quadrant, and no more active vowel sounds, and left upper quadrant, no more findings, and left lower quadrant, no more vowel sounds. Then I'm going to listen, auscultate aorta, and I'm listening for, which is right, it's located above the umbilicus, and I'm listening for any bruits or turbulent sounds. It branches down to the two renal arteries, bilateral, so I'm also listening for bruits or turbulent sounds, bilateral. And if I had a scope that's got bell and diaphragm, I'll listen bilateral to both sides. My scope is a little advanced, so I just listen on one side. Below the umbilicus is the iliac arteries, which are bilateral as well. I'm also listening for bruits or any turbulence sounds. Below the pubic symphysis is your femoral arteries, and I'm listening as well bilateral in the femoral arteries. After no abnormal findings, after listening to these sounds, I'm going to auscultate above the hepatic and listen for if there's any hepatic friction rubs above the liver in the right upper quadrant, and there's no abnormal findings there. And then on the left side, on the 10th intercostal space, I'm listening to the spleen to see if there's any splenic friction rubs, and there's none. No abnormal findings. Next up, my exam is going to be percussion, and I'm going to percuss in all 4 quadrants, starting with the right lower quadrant, and I'm going to percuss using my middle finger and striking the middle finger. And I'm listening for timpani sounds. Timpani, right lower quadrant, right upper quadrant, timpani, left upper quadrant, timpani, left lower quadrant, timpani. And I'm also want to percuss over the liver and on the spleen to see if there's any tenderness in those areas. And to get to your liver, I will start on the mid umbilical gastric area and percuss, and it's timpani, timpani until I find a dull sound, and that's the liver, and there's no tenderness there. And then on in between the 10th intercostal space, I'll percuss, or you could ask patient to turn on the side. For privacy purposes, I'll have us stay here, and you percuss, and there's no tenderness there. At this point, I would like to measure the liver, and I'll take my ruler and my marker, and I'll start again from the mid umbilical region, and I'm going to percuss up until I find a dull spot, and that's the base of the liver, and I'll put a marker there. And you want to go on top of the liver, so you start above the nipple line, but right above in the intercostal space. And the sounds I'm going to hear in between are going to be a resonance, because that's a lung field, and on the rib area it's going to be a dull sound. So you start there, and that's resonance, dull, and in between there's a dull spot there, and that's your liver in between the cartilage, between the rib cage. You're going to put your spot there and measure the 2, and it measures about 7 centimeters, which normal is 6 to 12 centimeters. The next step in the exam is going to be palpation. I'll start palpating using my one hand, and this is light palpation. It's going to get the patient to get used to the cold fingers and to get the giggles out. And you start by doing light palpation, right lower quadrant, also feeling if there's anything abnormal there. Right upper quadrant, no abnormal findings. Right lower quadrant, no abnormal findings. Left lower quadrant, no abnormal findings. Then we're going to go deep palpation, which will be 5 to 8 centimeters. And this will have both of my hands, and it's going to be another deep palpations. Also looking to see if there's any masses that's moving or anything irregular, and no abnormal findings in the right upper quadrant. In the left upper quadrant, no abnormal findings, and we're in the left lower quadrant, no abnormal findings. Now, if you want to feel the liver, the normal should be smooth. So in order for us to feel that, there's a technique you can use, the hook technique, which is kind of bending your fingers and asking patient to take a deep breath. And when they breathe in, you can kind of put some pressure and curl your fingers, and when they release, the liver kind of comes down, so you can feel that it's a smooth liver, no abnormal findings there. And you could do the same thing on the left side with the spleen, but you should not be able to feel the spleen because that's an abnormal finding. I'll do 2 tests, which one will let us know if patient has any gallbladder issues like cholecystitis, and the test we do there is a Murphy's test. And basically I ask patient to take a deep breath, and I'll put pressure on her right upper quadrant, and when she breathes and has a cessation of breathing, it's a positive Murphy sign. It could suggest or could be indicative of cholecystitis. So you ask the patient to take a deep breath and you breathe in and out, and then take another breath. As they're breathing, you push. There's no abnormal finding in this exam. And then another test you would do, this one is on the right lower quadrant. This one we check for anything with appendix, appendicitis. This is McBurney's point, and this one is found in between umbilicus and the right iliacus crest, 2/3 down, and you'd put pressure there and let go, kind of like a rebound pain there. If there's pain of releasing, and then it's a positive McBurney's point. At this point, you also want to try to see if the patient is having any abdominal rebound pain with touch. So you push down, put some pressure, and once you release, quick. And then if patient is having pain after release, that's the rebound pain, tenderness. At this point, I would ask my patient to sit up. We check for the vertical coastal tenderness in the back, which if it's positive, it would suggest that there's pyelonephritis or cholelithiasis, kidney stone, or anything renal related. So you'd want to make sure you use your non-dominant hand and use your dominant hand. You find the 12th rib on both sides, and you put your hand, your non-dominant hand there, and you percuss your dominant hand. This would be indirect because I have my hand here and no pain there. If the patient had renal colicky or cholecystitis, it's very painful when you do this exam, so the patient will jump just by giving a percussion there. So you do that on both sides. And that concludes the exam. Thank you. Have a good night.